Welcome to Healing Horizons, Ibogaine Therapy in Mexico. I'm your host, Liam, and today we have an enlightening episode that promises to open up new avenues of understanding in the fight against addiction and mental health struggles. Joining us is a true expert in the field of Ibogaine therapy, someone whose insights have helped countless people break free from the grips of addiction and reclaim their lives. Please welcome to the show our distinguished guest. We're thrilled to have you. Let's dive right in, shall we?
Thank you, Liam, for the warm welcome. It's a pleasure to be here, sharing knowledge on such an important subject. With the challenges we face in addiction treatment today, discussing alternatives like Ibogaine therapy couldn't be more timely.
Absolutely. Let's get right into it. To start, could you give us an introduction to Ibogaine therapy? What exactly is it and what are its origins?
Certainly, Ibogaine therapy is a treatment modality derived from the root bark of the African tabernanthe iboga plant. Traditionally, it has been used in spiritual and healing ceremonies by the Bwiti tribes in Central Africa. It's known for its psychoactive properties, which have been leveraged in these indigenous rituals to induce deep spiritual introspection and healing. Over time, attention turned to its possible benefits in addiction treatment. The realization that Ibogaine can significantly reduce or eliminate withdrawal symptoms and cravings for substances like opioids has been a groundbreaking discovery in alternative medicine.
That's fascinating. It's intriguing how traditional healing practices can have such modern applications. How about we compare this to more conventional addiction treatments? Can you provide an overview of the methodologies typically employed in traditional rehabilitation programs?
In traditional addiction treatments, the methodologies often include a combination of detoxification, counseling, and long-term follow-up care designed for relapse prevention. Detox is usually medically supervised to ensure the safe management of withdrawal symptoms. After detox, patients typically engage in either inpatient or outpatient rehab that involves behavioral therapies such as cognitive behavioral therapy, group counseling sessions, and sometimes medication. These programs are rooted in a structured, gradual approach and often include 12-step programs or similar support groups for ongoing recovery support.
There are certainly a lot of structured elements in traditional rehab programs. Now, shifting focus back to Ibogaine therapy, what are some of the key differences in how Ibogaine therapy approaches treatment compared to these more conventional methods?
One of the primary differences lies in Ibogaine's holistic approach, which encompasses the mind, body, and spirit, unlike conventional treatments that are often more compartmentalized. Ibogaine facilitates an intense psychedelic experience that can lead to profound personal insights and self-awareness, helping individuals confront the root causes of their addiction or mental struggles. This therapy aims not only to alleviate the physical cravings and withdrawal symptoms, but also to induce a transformational state of mind that can be pivotal in sustaining long-term recovery. Moreover, it starkly contrasts with conventional treatments by addressing the spiritual and psychological dimensions of addiction, providing a more comprehensive healing approach.
It sounds like Ibogaine therapy emphasizes a more integrated approach to healing. How significant is the role of the psychedelic experience in this form of therapy?
The psychedelic experience is indeed central to Ibogaine therapy. This experience can facilitate a deep state of introspection and emotional processing. Patients often report accessing repressed memories or emotions, gaining new perspectives on their behavior and life choices. This can lead to transformative insights that contribute to healing the psychological aspects of addiction. The temporary altered state of consciousness allows individuals to dissociate from ingrained habitual patterns, giving them a unique opportunity to reset and start anew. Although this experience is intense and must be carefully managed in a controlled setting, many find it to be an essential component of their healing journey.
The transformative potential of the psychedelic experience sounds incredibly compelling. What does the current evidence and research say about the efficacy of Ibogaine in treating addiction?
Emerging research and anecdotal evidence suggests that Ibogaine can be quite effective, especially for individuals dealing with opioid addiction. Studies have reported significant reduction in withdrawal symptoms and cravings following Ibogaine treatment. While large-scale clinical trials are still needed, smaller studies and numerous patient reports provide promising data on its ability to interrupt addiction cycles and promote sustained abstinence. Research has shown that the therapeutic effects can lead to neurobiological changes in the brain's reward systems, which are typically implicated in addiction. Yet, it is worth noting that Ibogaine therapy is not a cure-all, but can be a powerful tool when integrated with ongoing therapeutic and support measures.
It's remarkable how Ibogaine therapy has shown promising results, yet like you said, it's not a standalone solution. Can you share any personal stories or testimonials from those who have undergone Ibogaine therapy?
Certainly, we've had numerous individuals come forward with inspirational stories. For instance, there was a gentleman who struggled with opioid addiction for over a decade. Traditional rehab programs didn't work for him. After undergoing ibogaine therapy, he experienced what he described as a profound spiritual awakening and gained significant insights into his life and choices. His narrative highlighted a shift in his perspective, where he began to value his health and relationships more deeply. He remains in recovery to this day, crediting his success to the initial reset Ibogaine provided and the continued support he pursued thereafter. Testimonials like his are quite powerful as they highlight both the potential and the importance of integrating ongoing support post-treatment.
Those stories indeed highlight the potential for profound change. However, there are challenges within traditional rehab programs that may motivate someone to seek alternatives. Can you discuss some of the limitations and challenges these programs face?
One of the primary challenges traditional rehab faces is a one-size-fits-all approach, which often fails to consider the unique and individual aspects of each person's struggle with addiction. Additionally, these programs may focus heavily on the physical aspects of addiction, sometimes neglecting the psychological, emotional, and spiritual facets. The success rates can vary significantly, and relapse is a common occurrence. Plus, access and affordability can be significant barriers. For many individuals, the lack of personalization and comprehensive care results in repeated cycles through these programs without lasting success.
Those are definitely significant challenges. In contrast, what safety considerations and potential side effects should individuals be aware of with Ibogaine therapy?
Safety is indeed critical and cannot be overstated. Ibogaine therapy must be administered in a medically supervised setting due to potential risks such as cardiovascular complications. It's essential that candidates for the therapy undergo thorough medical evaluations before participating. Side effects can sometimes include nausea, ataxia, or hallucinations that some might find distressing. Given the strength of the psychedelic experience, it's crucial that the therapy is facilitated by experienced practitioners who can support patients through the experience safely. While the therapy has significant potential, these considerations are vital to ensuring that it's both safe and effective.
It's clear that careful management of the therapy is essential. To wrap up, how does Ibogaine therapy synergize with ongoing support systems to aid in recovery?
Once the initial effects of ibogaine therapy have created a reset or interruption in addiction patterns, ongoing support is critical. Integrating cognitive therapies, counseling, and group support can greatly enhance the chances of sustained recovery. Continued engagement with therapists or peer groups helps keep individuals accountable and offers means to work through challenges as they arise. The Ibogaine experience can act as a powerful catalyst for change, but it's essential to have structures in place to maintain and build upon these changes. The synergy of immediate therapeutic effects with structured, long-term support creates a comprehensive pathway for healing and growth.
It's wonderful to see such a holistic approach to recovery being emphasized. As we conclude today's episode, it's evident that Ibogaine therapy is more than just an alternative. It represents a beacon of hope for many. Thank you for sharing such valuable insights. Thank you once again for joining us. And to our listeners, we hope this episode has given you a more nuanced understanding of Ibogaine therapy and how it compares to traditional treatments. Remember, the journey to recovery varies for everyone, and considering all options is crucial. Until next time, stay informed and hopeful.